Hello, and welcome to the Dementia Minute Series. In episode 2, we're going to talk about normal aging versus the early signs of dementia, and how to recognize when everyday forgetfulness may be something worth paying closer attention to. We all forget things. You walk into a room, and suddenly you can't remember why you went there. You forget someone's name, only to remember it 10 minutes later. You put your glasses down and spend the next 20 minutes looking for them. And sometimes, especially as we get older, we stop and wonder, is this normal aging, or could this be something more? The good news is that occasional forgetfulness does not automatically mean something is wrong. Our brains change as we age. We may process new information a little more slowly. It may take longer to recall a name or find exactly the word we're looking for. We may occasionally forget an appointment, misplace something, or walk into the kitchen and wonder what we came in there to get. Those experiences can happen with normal aging. The important question isn't simply, did I forget something? Instead, we look at 3 things: pattern, progression, and impact. Let's look at what that means. Misplacing your keys occasionally can happen to anyone. You may search the house, retrace your steps, and eventually remember, oh, I left them beside the coffee maker. But repeatedly losing things, putting them in unusual places, and being unable to retrace your steps to find them may deserve closer attention. Forgetting someone's name and remembering it later can also be normal memory lapse. Most of us have had the experience of seeing someone we know and thinking, I know this person. Why can't I remember their name? And then 10 minutes later, the name suddenly comes to us. That is very different from repeatedly forgetting familiar people, important events, or information you recently learned, and not be able to recall it later. The same is true with time and place. Occasionally forgetting what day of the week it is and then remembering is one thing. But becoming confused about where you are, how you got there, or losing your way in a familiar place is something different. And we all occasionally need help learning something new. Anyone who has stared at a new phone after an update and wondered where everything went can probably relate to that. But difficulty completing a familiar task you performed successfully for years may be more concerning. Maybe someone who has always managed the household finances begins repeatedly missing payments or making unusual financial mistakes. Perhaps a person who has cooked the same family recipe for 30 years can no longer remember the steps. Or someone becomes confused while driving a route they have traveled hundreds of times. Those changes deserve attention. And dementia is about much more than forgetting names or losing keys. Depending on the cause and the areas of the brain affected, early changes can involve judgment, language, problem-solving, attention, personality, visual and spatial abilities, or the ability to manage everyday activities. Someone may begin struggling to follow a familiar conversation. They may have increasing difficulty finding words. Their judgment may change. They may withdraw from activities they once enjoyed because those activities have become confusing or difficult. Family and friends may notice changes before the person experiencing them recognizes those changes themselves. That brings us back to those 3 important words: pattern, progression, and impact. First, pattern. Is this an isolated lapse, or similar problems happening repeatedly? Second is progression. Are the changes becoming more frequent or more noticeable over time? And third is impact. Are those changes beginning to interfere with the person's ability to work, manage finances, prepare meals, drive safely, take medications correctly, communicate, or just manage everyday life? One isolated memory lapse usually tells us very little, but a persistent and progressive pattern that begins interfering with everyday function deserves further evaluation. There's one more distinction that is extremely important. Dementia usually develops gradually. If someone experiences a sudden or dramatic change in thinking, attention, awareness, or behavior, especially over hours or days, don't simply assume their dementia has suddenly gotten worse. A rapid change could be a sign of delirium or another acute medical problem that should be evaluated promptly. We'll explore that much more closely in an upcoming episode. So if you're noticing a pattern of cognitive changes in yourself or someone you love, don't simply just dismiss them as they're just getting older. Talk with a healthcare professional and ask for an evaluation. There are many reasons changes in memory and thinking can occur. And identifying what is happening early gives us more opportunity to understand the cause, address factors that may be contributing, and determine what can be done. Remember, dementia is not a normal part of aging, and memory loss does not always mean dementia. In episode 3 of the Dementia Minute Series, we're going to explore some of the other conditions and factors that can affect memory and thinking, including medications, sleep problems, nutritional deficiencies, infections, metabolic and medical conditions, and delirium. We'll also talk about something frequently encountered in older adults: how an acute illness, including a symptomatic urinary tract infection, can sometimes contribute to a sudden change in cognition, and why sudden confusion should prompt us to look for the cause rather than simply assuming dementia. Because when cognition changes, sometimes the most important question isn't, is this dementia? It's, why is this happening? I'm Mark Robertson with Life Health Now. Thanks for listening to this episode, and tune in next time. And remember, knowledge reduces fear, and understanding creates compassion. Live today and create a healthier tomorrow.